Assalamualaikum. A very good afternoon to everyone. Welcome to our webinar today. So the topic for today will be addiction, science, causes and help. So our speaker for today will be Dr. Edward Chan. So I think without further ado, I would like to invite Dr. Edward to deliver the webinar for this afternoon.
Right. So of course I'll be co-host with Rashida, who is also very experienced, as you had just heard. She is heading or in the part of the faculty for the rehab center in University Science Malaysia Sarawak.
I'm one of the lecturer.
One of the lecturer, but you
Yeah.
you have patients there, right, in the rehab center?
Yeah, we have patients coming for physiotherapy. We have quite a number of clinics in the rehabilitation.
Fantastic. Great. And I would also just like to add a few things on my credential about this addiction therapy. So I'm one of the very few what we call certified substance abuse counselor, CSAC, which is an international organization for the training and certification of substance abuse and alcohol addiction therapy, right? So I've got my certification from the state of Hawaii, alongside some of my colleagues many years ago, including Paxton, who run the prison addiction center for Malaysia as well. And in addition to that, I'm also certified by Dr. Daniel Amen, who of course wrote a best-selling book on addiction called Change, Change Your Brain or something like that. We have some CD version of it. The book is out of date. So Amen has a very specific protocol to treat addiction. So those are some of my background on addiction therapy. And today we will be talking about addiction in general. Of course, addiction. Those of you who study literature might know Oscar Wilde, one of my favorite authors, who said anything pleasurable can be addictive, right? So, but for addiction, we are talking about any behavior which give you maybe some short-term gain, but certainly is dysfunctional, and despite it doing you harm and being dysfunctional, you are not willing or not able to stop it. If you're not willing to stop it, so there's a fine line here, not willing and not able, right? And we're going to be talking a little bit about various forms of therapy that has come about to treat addiction, including motivational interview, which is a therapy that has been formulated just to treat addiction. And in motivational interview, you start by assessing what is the motivation of the patient, right? And if the patient is totally not interested, not motivated, to change, then you start with that, right? And there's another form of therapy called existential therapy, which look at the meaning, of a purpose of things, and it was started by Viktor Frankl, who a well-known psychiatrist who was imprisoned in the concentration camp, but he was like one of the very few survivors. Despite his physical stature, he was able to survive the horrific condition of the concentration camp because he had a purpose, in life at that time, which was to write his book and then meet his wife, although his wife died before even he knew about that. So the whole idea of a purpose is very important for the thriving of human beings. So if the patient is totally not interested to change and see whatever they are doing as what they want to do, then it's arguable whether, you know, we should be treating them, right? So with these two concepts in mind, you know, we want to enter into this discussion of the whole realm of addiction, where we talk, you know, about all forms of addiction, from what is socially acceptable, like internet addiction, work addiction, you know, to what is socially not acceptable, and what is legally acceptable. Like, of course, no, a lot of drugs, marijuana is now legal in many parts of US and the West, and has been and a lot of substance which is considered to be addictive has been used for thousands of years by Native Americans, tribal organizations. So these are things that we need to discuss, really. You know, what is addiction and what is not is not entirely simple, right? You can have two person jogging, right? And then maybe the same pace and everything, but one can be an addict, you know, of jogging, and one is not, right? It depends on the motivation, why they're jogging, what they're doing it for, you know. So it is a very complex situation. So with that intro, I pass back to you, Rashida.
Okay. So for this afternoon, I think we can we open the Q&A already, Dr. Edward?
Yeah, we want this to be very interactive and collaborative. Although both of us have a lot of knowledge, but we don't know everything. And I'm sure that there are a lot of contribution and questions from the participants. So you can ask directly or send in the chat box, right? So either way.
Okay, I would like to open the floor to everyone that would like to ask questions to Dr. Edward for this afternoon. Our topic is on addictions, sign, causes, and helps.
Indeed. So we can talk about anything under the sun about addiction, as long as it's addiction. Okay. And that's already a question. You can fill the questions, Rashida.
Right. I think Joanne Kwan had posted something on the chat. Dr. Edward, when you said earlier, not willing versus not able, tell me more.
Yeah. So really, we need to make the distinction, because addiction for many years have suffered a really bad press, right? People think that the addicts are just people with weak will, right? That they have some character flaw, that they're not very willing to like give up whatever they're addicted to. But this is not the case, which is why addiction, you know, substance abuse, alcohol, and various even the new form of addiction is now in DSM-5, right? Which is a medical diagnosable manual that psychologists and psychiatrists use. So the idea of it being a disease means that these are patients not capable, right, on their own for change, unless that they receive some treatment. You know, it could be psychotherapy, it could be medical treatment. So they need to have some treatment. So this is the concept of not willing versus not able to versus not willing to, right? Not willing to is you know, you don't want to, even though you can. Yeah, it's a fine line, but it is an important distinction on how we see addicts and whether we see as a disease or not. I hope that answers somewhat your question, Joanne, or not.
Okay, Elrina Shin, what is the source of addiction of a person, and how did a person get addiction?
Right, like I mentioned, I mean, half jokingly by Oscar Wilde, who said anything pleasurable can be addictive, and that is true. Pleasure, we experience pleasure through a chemical in our brain, okay, what we call neurotransmitters, called dopamine, right? So we have patients who, you know, are not able to experience pleasure. They don't have sexual pleasure, for example, libido, you know, or other pleasure. And when you are depressed, you know, you lose your ability to experience many pleasure in life, you know, as simple as eating, having sex, you know, all these are decreased. And that is simply because your dopamine level decreased, right? So going back to the source of addiction, well, if you experiment or experience pleasure, right? Whatever form that might mean, you know, it might mean taking some drugs, having some alcohol, having great sex, listening to music, you know, it could be anything that give you a burst in dopamine level, then you would want to experience this pleasure again, all right? And this is where it can become addictive. So the question then is when you are doing it, you know, whether you will continue to do it despite of some harm to yourself or some cost to yourself, right? So now, you know, I might get pleasure by I don't know, having, you know, playing tennis, for example. I know I love doing that, but I'm going to curb that now because I need to give a webinar to you guys, right? So I'm able to control my desire to do various things. But an addict, they will not be able to do that, or they're not willing to do that. Well, they're not being able to, okay? And despite their willingness. So this is the difference, right? So it started with the rise in dopamine, and then the patient become dependent on those behavior and lifestyle, and they're not able to change it despite having cost to them. So why is that the case is a further question, right? There is a whole host of biosociological issues and causes as well, which we can go into it a little bit, but that is the short answer. I forgot who asked that question. But,
it's Arina.
Arina, okay.
Yeah.
Yes.
Okay, Kamini, question is that is there a such thing as good addiction, or all addiction is not contribute to
yeah
negative?
So like I mentioned, when the pleasurable activity is something that you are not able to stop, you know, or give up, even when it's doing you harm, then, you know, then that is our definition of addiction. If you can stop it, right, then it's not an addiction, right? I can stop playing tennis now because I'm you know, talking to you guys. Then I'm not addicted to tennis, even though it's very pleasurable for me doing that. Yeah, so that is the difference. I'm able to organize my time and be here, even though there are, you know, 1 million other things I can be doing, which are very pleasurable as well. And of course, this is very pleasurable for me too, talking to you guys. But that is the difference. So there is so all addiction is therefore negative in the sense of causing harm to the person, right? So that there is no positive addiction as such, you know, unless you know, like we briefly touched on that in the beginning, unless this is something that the patient wants, right? They know the harm and everything, and in their view and purpose of life, this is how they want to live their life, right? So it's totally congruent with their meaning of life. Then I guess, you know, that might be a situation whereby that would be positive in that sense, that it is aligned with their purpose of life, right? To give you a short story, I don't know whether you guys know about the founder of Gestalt Therapy, Fritz Perl. You know, he was an addict, and he was living in the street for many years, right? Before he found Gestalt Therapy. I think he was in his 60s, literally, and then, you know, a tramp, and then one day he woke up to this new idea of psychotherapy, Gestalt Therapy, and he totally gave that up, living on the street as an addict. You know, so his view of life changed, his philosophy of life changed. But before that, you know, he was happy being a tramp and an addict. So that was congruent, and that's probably positive. So in a way, we also need to allow space, you know, for I mean, addiction is very subjective. You know, if the person chooses that way of life, and the more we impose and then try to change them, the more they will resist. Whereas the more we give them the space, you know, and be with them and the resources, the more likely that change would take place in a way that is beneficial to everyone. That would be my take about positive and negative addiction. Kamini, a long answer. Sorry about that.
Okay, moving on to the next question from Pepe Tube. Can you share some case study about addiction?
Right. Yeah, we have many different form of addiction. A recent case I have, which some of you might know in the faculty and, you know, when students was you know, a young man addicted to masturbation, right? So he's pretty addicted to this activity, because obviously it gives him a lot of pleasure, right? Dopamine spike. But at the same time, he has also probably due to upbringing and things, he has developed a lot of judgment against this activity. So he's torn in between, right? So part of him will want to engage in this behavior, but other parts, probably because of his educational background, because of his physical problem, you know, because if you masturbate too often, it's going to make you weak. Then he has the part of him that criticize himself, you know, for this activity. So has developed what we call OCD as a result, and you know, obsessive compulsive disorder, which is also a form of addiction. So like every time he masturbated, he would need to do certain action, you know, which he cannot not do. So then he has various forms of addiction. All right. He not only he was addicted to masturbating, even though that is something that part of him didn't want to do, and it caused him a lot of pain. On the other hand, he's also addicted to do a lot of compensating behavior, like praying to the gods and things after masturbating, right? So that is one example of maybe a little bit complicated situation of addiction of a case, but there are many more, depending on what sort of case you would like to know.
Okay.
Computer game, yeah, all right. So you feel the question, Rashida.
Okay. Next is from Rosima. what is the defining line between passionate about something and addicted to something?
Right.
Can someone be aware of this?
Yeah. So again, it goes back to this question about benefits and costs, right? So you can be very passionate about things, you know, and so passionate that when you pursue it, you lose everything else, right? So it depends on your meaning of life, right? A very well-known addiction specialist, you know, Dr. Gabor Mate, some of you might want to check it out. He's a psychiatrist. You know, he admitted he has been a work addict, you know, for many years, and he has lost, you know, communication with his own children, and his relationships suffer, you know, but he would become very successful in work. But then later on, he changed. He realized that that was an addiction, which has costed him a lot in terms of what he wants in life. So we need to do an appraisal from time to time to see whether our life is in balance and is according to what we desire. You know, passion about something is great, but if you pursue it, you know, at the cost of everything else, then it's questionable whether it has it not turned into an addiction, right? So that would be some answer to that.
Okay. Fat Lim, what if the person is full of awareness or caution over the addiction, but just now able to break it?
What happens if the person is conscious but are not able to break it?
Able to break it.
Able to break it.
Yeah.
Right. So that means they are pursuing it despite them being fully that they're pursuing it, knowing all the consequences, and they can break it at any time, but they're still pursuing their passion or whatever addiction it is. Not able to break it. So Faith corrected himself. So then that is clearly, yeah, that is clearly an addiction, right? So if they are not able to break it, you know, then there is clearly an addiction. Addiction is when there's no choice, right? When choice is taken out from you, right? If you are able to break it, you know, but you choose to do it, then it's not an addiction. Addiction is when, you know, I choose to stop, but I cannot stop, right? I choose to stop working, but I'm so engrossed in it that I'm not going to turn up for my child's birthday or you know, a dinner date with my wife. Then, you know, that is clearly an addiction, right?
Okay. Andy is asking, is there any general advice for someone that is looking to kick an addiction, something that might get them past the unwilling stage?
Right. So something that would help them to go from unwilling to willing. Right. We need to explore, first of all, what is the unwillingness about. Right. So this is where motivational interview come in, you know, for those of you interested. We have a course in this, and I, you know, it's a fantastic form of therapy. You know, we want to get to a stage of ambiguity, right? We want to go to a stage of ambiguity with the patients, right? Where we are able to shift them from unwilling to willing. So we need to like do a motivational interview to find out what is the motivation, why are they unwilling, right? So I don't know, maybe Andy, you have you know, some example that we can use.
Sorry, doctor. I guess maybe let's say, for example, that someone's partner pushes them to go and seek help for an addiction. So but themselves are in some kind of denial, but they're being pushed to come and get help.
Yeah, yeah. So that is I don't know, whether you guys know about the 12 steps program, very famous for treating addiction, right? So one of the first step is to overcome denial, right? Of course. So denial is like one of the first thing that would happen, and we need to get the addict to the stage of acceptance, right? That they have an issue and they need help, right? So then we need to stay at that first stage to talk about this, to give a very empathetic, validating, and yet confrontational, to confront them about the issue, but not to the extent that you're going to be driving them to defending the problem, to validate, because this form of addiction, whatever there might be, has become the crutch, right, for many years. So the more you challenge them about it, the more they will fight you about this addiction. So it needs to be done in a very what we call empathetic confrontation, right? So we need to empathize with the addicts on their use, but at the same time confronting them, so that we don't sweep the problem, so that we don't become what in the field we call enabler, So there are many enablers, that the partners, the parents, can be enabler of the addiction behavior. So we don't ourselves become an enabler. We do confront the behavior, right? But at the same time, we don't. We are also empathetic. All right. So that is like general way to answer your question, Andy, and if you can give more specific information about the addiction itself, maybe we can give you.
Yeah, thanks, more. Doctor. I guess I was thinking, if someone might come in and say that, I've been pushed to come in to seek help, but actually I don't feel that it's a problem myself. And I do recall you saying one time before that you might ask questions about the time that's lost, perhaps, or what it takes away from their lives, basically, without them perhaps realizing it.
Yeah, that all can be done, right? And so we can do like a cost analysis for with them, what they, and then it's always easier to start with what they get out of it versus then later what it costs them, right? And get them to do it'll be like a collaborative brainstorming type of session that we all do. We can invite a partner as well, that we all do together. So tell them, this is not therapy. We're just going to have a chat about this lifestyle that you've been having to see whether we need to do anything about it or not. So it's just not threatening for them. We're not like imposing that they need to change, but we're just going to have a chat about it and see where we go from there. And what you get. So you need to come, that the insight need to come from the patient, that they see it is beneficial for them to change, right? But if they continue saying it is not an issue, then there's nothing anyone can do.
Doctor, can I have a quick question in terms of this? If
yes,
our partner is the one that was having the problem, we think it's a problem, but they do not think it's a problem, but it's bothering me. So am I the one that I should seek therapy, like maybe a Gestalt therapy myself? Because
I would say if you're in a relationship and it is a behavior of your partner, I would suggest both of you seek therapy. Do it as a couple, right? As a couple therapy, because it is affecting the relationship. Relationship is a two-way thing. As long as one feel that there's an issue, then there's an issue in the relationship. I would suggest that.
Okay, thank you.
Yeah.
What if the partner refused to?
Well, then you have no choice but to come in on your own, and we can still bring him in virtually. I mean, not virtually. We can bring him in. How do we say it? In spirit, right? We'll put an empty chair there for you to talk to him.
Yeah, understand.
Okay? So the thing about therapy is it can be systemic, which means in a couple relationship, even though we won with one party and one party change, it will change the whole dynamic of the relationship, and even that issue that is troubling you, when you change, he might change that lifestyle as well. Okay. So back to you, Rashida.
Okay, Arina has a question on computer game addictions. It's something that becoming very serious nowadays with the nowadays children. So she's asking about the effective therapy that are available to break this change.
Yeah, well, on that, I think as parents we need to be careful not to expose our children to computer game, too early, when the brain is still developing. It is a very addictive behavior because gamers are experts in psychology. I would say they know how to reward the dopamine system and design the game in such a way that you get a lot of instant gratification, that everything else become boring. Doing your homework is boring compared to doing gaming. So I would urge you to rarely limit or avoid exposing your young children to this. But once it's hooked, then it becomes all addictive behavior is very difficult to treat, right? Because I mean it is like you're willing to give up everything for a shot of whatever it is, and children is no different. So the way to treat is you need to go through this cold turkey withdrawal phase, right? So that is one of the definition of addiction as well. So when you don't do it, you will get withdrawal effects, which is very physical and psychological. You will be physical to the extent, if you have alcohol withdrawal, you can even die, right? In the short term, if you are heavily dependent on it physiologically. But there are certainly a lot of psychological symptoms of irritation, being depressed, cannot concentrate. So, but these are necessary period that you need to help the child. So you need to help them, support them to go through this withdrawal period. So it's not a time to do homework or anything else, just to be with them, but no gaming, go through this withdrawal period. And after that, the brain get rewired, they go through the, it's only temporary. You need to give them some psychological resources to see that, this is only temporary. And for children, it's difficult for them to grasp that. Then things will become easier later, right? So there's no shortcut in this. Unfortunately, you have to stop the gaming for a while, right? But if you continue giving it, you are just enabling the addiction. Okay.
Okay. Okay. There's one more question from Andy. Is distraction an effective approach to getting someone off an addiction?
Well, I would not even call it distraction. It would be a replacement. Would be a better term, right? Don't forget, addiction is all about spiking the dopamine, and there are many ways to do that. Listening to the music, and that's my one form of addiction therapy, if you like, I'd always change my music, after listening to it a few times. it doesn't give me that dopamine rush anymore. I will need to find new music, and thank God today for Spotify. I mean, in the old days, I'm definitely a music addict, right? I would have like thousands of CDs in my student days that I would have, and so that was me. But nowadays, that maybe help me with my music addiction. That I don't need to bring with me thousands of CDs anymore. I just have my tab with me, right? So you need to find a more socially acceptable ways to do your addiction, right? That can be a way to replace the behavior to still enabling you to have this dopamine rise, and of course having relationship. Good relationship is a great way of replacement, and many of these get sacrificed to pornography, to I don't know, Facebook chatting and all that, which is not real relationship. It gives you some temporary dopamine high, but it's all very transient. Whereas when you have a real relationship, you get the pleasure from conversation, from all the dynamics of bonding, then that would be a great replacement of any addiction that you have.
Okay. There's another question from Pepe Tew here. There is a 13-year-old teenage with internet addiction. His screen time more than 8 hours. Is there an effective therapy to cut the screen time?
Well, first of all, we need to find out what he gets out of the screen time, right? There are the different thing that he might be using it for. So if we want to do a replacement, we need to understand that, right? And the other thing is also we haven't yet talked about this, but addiction is a symptom, right? And unfortunately, we have somewhat adopted the medical model, which is looking at symptoms of everything rather than the cause, right? I think someone asked earlier a little bit about the cause. We have talked a little bit about the physical cause, but really we haven't talked about the psychological cause, right? So that is the real cause of addiction. It is an attempt by the patient to solve some problem of pain, right? So the 8 hours per day screen time, of that teenager is probably because he has a lot of pain in his life, being rejected by peers, rejected by parents having no time for him, whatnot, right? So these are the pain he has been struggling with, and he has found the solution in the 8 hours screen time, to numb the pain. So unless we address those pain, we will never get to the true solution, right? So that is the quick answer to that. We need to find out a lot more, and that is why there's no replacement for treatment, from psychotherapy. In an addiction therapy, we need to really sit down with the addict and find out what has been the pain in their life, from childhood, even all the way from before childhood, during pregnancy. Research show that when the mother is stressed during conception, that will lead to a higher form of addiction, right? Because of the psychological trauma that the baby and the fetus experience. So all this is directly linked to addiction.
Okay, there's one question on smoking and vaping here from Suhaimi. Any therapy for those who are addicted to smoking and vaping?
Yeah, nicotine is one of the most addictive substance, all right? But on the other hand, smoking has been done by the local indigenous population, like the Aborigines, the American Indians, and it has never been addictive to them, So it depends on the context of it is used. You know, if it is used within a spiritual environment of awakening, of insight development, then it's not addictive. But if it's smoked with today's you know, youngsters and in stores, in hangouts, you know, then it can become addictive. So we need to look at the whole lifestyle situation, you know, what is used for, you know. I used to be a smoker myself, so I totally know what it used for. You know, you like you would smoke for anything, you know, smoke to celebrate, smoke after dinner, smoke before. It can become an excuse for anything. Then it can become a problem. So you need to find a replacement, like we talked, you know, with Andy a little bit just now, to replace it. But if it is used in the right context, it can be a very an enlightening experience, right? So now there are a few psychologists and psychiatrists looking into various substances, you know, to cure addiction even, you know, in the Peruvian jungle, and ayahuasca, you know, some of these substances that indigenous population have used, but they use it, you know, they smoke it in a way to give them insights, I know, about their psychology. So that become a treatment in itself. So it depends on how you use it. But unfortunately, smoking, you know, and then wasping has been used in a way that doesn't support, you know, our spiritual and social well-being, you know, in a conducive way, and that has why it has become a problem, right? But you know, going back to the smoking and nicotine, the physical dependency, you know, it takes only 3 days, right? If you, I know it, you know, if you don't smoke for 3 days, you do not have the smoking and you do not have the physical dependency on nicotine, right? But of course, most smokers will find that very difficult, even beyond that, because of the psychological dependency that they have, you know, used. So the smoking has become the crutch. There's, you know, they are psychologically, emotionally dependent on it, not just physically. That's why. So this is where the real addiction is, you know, and this is where psychotherapy has to come in to help solve, you know, these pain issues that I was talking about. You know, the lack of confidence, maybe the person experience when they're interacting or whatever it is that smoking give them, you know, that they cannot do without otherwise. So those need to be addressed before that they can cure themselves of the addiction.
Okay. There's one question again from Arina. Can medication used to suppress addiction? If yes, what they are?
Well, we can definitely look at ways to, and even before that, and we have talked about dopamine, right? And I believe one of our intern Ian is putting up a post somewhere about that, right? And maybe Tommy, you can get Ian to send us a link of the. It's probably in the social media post. Yeah, you can read more about it. But there are studies to show, and in our lab, you know, we run also WellLab, which has a mental health component. One of the tests we do is one of the tests we do is a dopamine test. It's a urine test to test your level of dopamine and other neurotransmitters, and we do find that addicts have much lower level, right, of dopamine, and this could be the reason partly why they have resorts to addictive behavior in order to spike up their dopamine. So we can supplement with dopamine precursor, right? That there are drugs, that there are non-drugs, there are natural substances like L-Dopa. You know, for those of you who are interested, we have a website called NutriMed at Club. You know, maybe Tommy, you can put in a chat box. You know, NutriMed at Club. So it's all about supplements and energy medicine to support your neurotransmitters. So there are some of these natural substance that you can use to boost up your dopamine level and also other neurotransmitters that are implicated as well in addiction, not just dopamine, but your noradrenaline, your GABA level, you know. So we don't want to make this more too technical. There are drugs out there, right? There are different range of drugs. You know, some drugs work by cuddling. You know, Rashida, you probably can tell us more about that, right? Some drugs that work by just preventing you from experiencing the opiate release, you know, of whatever recreational drugs you are taking, right? So that is called the anti-abuse, right? You can take that. So with that you cannot. So it's a bit like a cold turkey type of situation. There are some drugs will give you a little bit smaller amount of release, you know, and going up. So there are various options, but the option we prefer is to use these natural precursors, L-Dopa, right? Because at the end of the day, our neurotransmitters share the same transporters, right? So that means if you focus on, say, one, like dopamine, you know, and then you're focusing on boosting that, later you will end up depleting other neurotransmitters. So we rather do it naturally, holistically, you know, if you want to use that in conjunction with other natural activities as well. So we can measure, test, do natural supplementation. There's one of the holistic way to do it alongside with other form of therapy. Okay.
Okay. Okay. There's.
So maybe Tommy, you can also show the link or the neurotransmitter test link, you know, of WellLab as well in the chat box for those of you who want to run some very simple urine tests on their dopamine level. We can also measure the genes. We're using a barcode swab to see whether some people, their dopamine, like I mentioned, receptors get compromised, right? That means that they have less ability to have dopamine, that they need more like dopamine arousing behavior to get the dopamine. So that can also be measured. That means these people are more susceptible for addiction, right? So there's a genetic component as well.
Okay. While waiting for the question, can I just share a little bit on the things that I'm doing at my clinic, Dr. Edward, on this smoking?
Yes, that will be lovely to hear that.
Okay. Just to share to everyone, I'm running a small clinic at the rehabilitation center for smoking and cigarette and vape. So I have basically I have two patients coming. Both are adults. Okay, one is on. Both of them are basically using both cigarette as well as vape. Okay, so the things that when I started the clinic with these two patients, normally I will start with looking at the background of the patient. Why are they using cigarette, and then why are they switching to vape at the later stage of the smoking habit that they have. So the things that I pick up from these two patients is that one of the cause that leading them to smoke is that this one is a lecturer. So basically it's due to stress because she undergoes her postgrad, and then during that time is the high times that she really smoke, and then she start to switch to vape. at that period of time. And the other one is basically is more of like leisure, and then apparently he cannot stop smoking. Okay, so to cut the story short, so what I do is that in my clinic, I experimenting this motivational interviewing therapy with both of them, and I found that the therapy is effective actually if the patient really comply to the session and comply to the goal that they are setting earlier when they are starting the therapy, because each patient have their own goals, and then we also need to assess their efficacy in terms of how comply are they to get themselves to curb the nicotine addiction. Actually, that is the thing that they have to control, the nicotine addiction. Okay, so following from the section throughout until the end, I found that both of the patients managed to control the addiction by replacing the urge of nicotine addiction to something else. For example, like this one guy, this one of my patient, I asked him what he liked to do when while driving, because most of the time he will start heavily smoke while driving in the jam or something like that. So he liked to munch. So what I asked him, what do you like to eat? I mean, like what you like to chew, something like that. So he says that he likes something that's sweet. So I advise him, would you like to try something like like a candy or whatsoever? But this is not totally drug. It's just a usual candy that he can chew while he have the urge. So he give a try of this, and then for a few times, and then he every time he feel out that there's a urge to smoke, he start to make his mouth busy with chewing things. So this is one way of this is one way that that can be used to get a person to start to forget about taking their cigarette at that period of time. Make your mouth more busy with something else just to replace. And the other one, the lady.
Well, if I may butt in here, that is interesting, but I would also at the same time be a bit careful with what you choose, to replace it with, because candy, like sugar addiction, is another form of highly addictive behavior.
Yeah.
As addictive as nicotine. So replacing nicotine with sugar, I don't think might be a good replacement. You might be jumping from the fire pan to the oil pan or whatever, right?
Yeah.
So we need to so there are of course a lot of cases where the addict in giving up smoking, they gain weight and whatnot because they switch to eating, food addiction. So I don't see that as a cure, right? So that become another problem. So we need to be a bit careful with that. But we have to wrap up soon, Rashida, because we have a couple of minutes left. We have another session of supervision to jump into. So maybe we can hand back to you to do a wrap up.
Yeah. Okay. So what I can sum from this afternoon discussion, that basically when you talk about addiction we can characterize it as something that a person is addicted to something. Okay, so and then they become dependent on it and then cannot stop it. So although they are trying to stop, so it's basically they can't do it and then they need help. So that is basically what I can understand by addiction. And then And then there also the role of dopamine in causing a person to initiate addiction. Okay, so and then I think there's quite a number of ways of how to curb addictions, whether it's in the form of behavior, psychological, and also from the medical perspective. So that's that's the thing that I can pick up from this afternoon discussion.
Well, sum up, yes, I think it has been a very generative discussion, you know, and thank you all for your questions as well. We'll be running this webinar in other languages, in Chinese and BM. So I think next week we will be having a BM version, and then the week after the Chinese. For those of you who like more and speak other languages, you're welcome to join, and this will be announced in the respective place. So have a nice afternoon, everyone, and we'll see some of the students in the next room during the group clinical supervision starting now. Bye-bye.
Okay, yes.
Thank you, Rashida.
Welcome.
Wonderful conversation. Thank you. Bye-bye.